Hi, my name is Claudine Lewis. I'm going to go over some mechanical ventilation general stuff with y'all. So here we use the Draeger Evita XL. The on button is back here in the back so that it won't accidentally be turned on or turned off. That would be terrible, especially while your patient's on a vent. So we're going to let it run through all of its stuff and beep very loudly. So I would kind of want to have this set up before I get to my patient and hook my patient up. So I'd want to check their chart, see what their ideal body weight is, their height, so that I can figure out their ideal body weight. They also use these little cards here and sheet that has it all on here. So let's go. I don't use 60. Let's go with 60. All right. So we're going to accept 60. And I'm in SIMD mode. That'll work. So we've started. Tidal volume is 410. Inspiratory time is 1.2. Let's make that a little faster. Let's go 1. Frequency 13. I'm going to make it 14. PEEP is 5. Pressure support is 5. Let's go up on our PEEP a little bit. We're going to want to watch their vital signs and see if that changes since I went up on the PEEP. O2 is 50%. I'm in SIMD mode. Let's check our alarm settings. Nothing's really changed. I'm going to change my low minute ventilation to 3. It was like 2.9. And my high to 9. Let's take that down. You want to have decently wide parameters, but not too wide. You want the alarms to go off, but you don't want them to go off constantly. I'm going to change my minute. That's too close. My minute ventilation to 7. I'm averaging right around 5.5 right now. My airway pressure is 40. Let's take that down. Let's go 30. Tidal volume high is 8.8, sorry, or 800 milliliters. Frequency is 35. Let's take that down to 25. Apnea times 20, that's got to be the default because their protocol here is 15. So I've set my alarms and I'm in SIMD mode. We're good there. Good way. And it's actually got a nice waveform. My raw is 9, my compliance is 55. Okay, let's change modes. So jump out. Let's go to pressure control plus. Perfect. The crap was that? Nothing's really changing on that. So there we go. I'm very tired of these alarms. Very tired. So I have my circuit here. I have it already set up. So let's say there would be a little bag over here. Oh, funny. Okay. So let's say I wanted to give my patient a breathing treatment. In my circuit, I would have this handy dandy tea. I would be wearing gloves. I'm just tired of them. So with this Draeger, there's 2 ways to do the nebulizer. I can either hook it up the old-fashioned way to the flow meter, or I can hook it up to this little port here, hit the nebulizer button, and there we go. So we have our nebulizer running, and that'll take a while to do that. While I'm doing that, I can go check on other patients, or do this patient's vent check, all that kind of good stuff. So I've turned my nebulizer off. Another option for medication delivery would be the MDI spacer. This won't work with anything but a metered dose. There's a little teeny tiny port over here, so I'm going to turn that so it's easier for me to get to. There we go. Perfect. It's up. So I would pull that out. It's just kind of a little piece of corrugated tubing with wire in it, so it'll collapse. So I'm going to shake and warm my MDI. I'm going to take the canister out and I'm going to squirt it into this little hole. So, and then I'm going to do an inspiratory hold, which is this little button right here. Hold that. wait just a few minutes, maybe 2, and do it again, squirt, and do my inspiratory hold. You should be able to see that. Yes, yes you can. So, and then after I'm done, I'm going to want to make sure I close that back up, which it doesn't want to do at all. Perfect. So, and it's about time for an alarm to go off again. So we've done a nebulizer, we've done our MDI, we're going to do some suctioning. So this represents my patient. So one of the respiratory therapists here told me it was a good idea to hold your breath because as long as you're going without a breath, so are they while you're suctioning. Your patient will still try to cough and gag, and you're just going to try to jam it down in there. It is harder on the smaller tubes, like once you get around to 6.5, it's a little bit harder to jam her down in there. And you're not going to want to squeeze and suction while you're going down. Squeeze and suction on your way back out. Perfect. You can also irrigate if you need to. You can squirt some saline in here and just hold your tubing in such a way that you're just cleaning the suctioning tubing. Or you can irrigate your patient just a little bit. Lavage. Maybe 1 or 2 cc's. So there's that. And I know there's an alarm going to go off about the time I get down here, so whatever. We're also going to want to do our oral cares and check our cuff pressures. I'm using an infant mannequin, so there is no cuff pressure to check. But you would want it to be right around 20. It's just a little manometer, and it just plugs into the little fill valve on the ET tube. And because you definitely don't want too much pressure for too long, it could cause damage to your airway. So we're on the patient's left side. Hold on, we're not low enough. We're on the patient's left side. There's an ET tube holder here. We're going to do some oral cares. So we're going to have this attached to suction. And we're mostly going to want to try to clean from the way back on the way to out. So that if there's any drier, crustier stuff, we can get that out and not shove it down into the patient's airway, which is protected, but you still just don't want to shove gross stuff down in there. We also have the swabs, which aren't really effective. They sort of work on the lips a little bit. Everything is going to be very dry because they're not able to moisten their mouth in any way, or lick their lips. All the stuff that we do and we take for granted, on a daily basis. So we'll do the one side, and then we'll move our our ET tube over, and we're going to want to make sure that we're at the same place we were. I'm at 17 at the lips. That kind of works. On this one, this is a size 4. So I'll just want to verify that nothing has changed, that I haven't shoved it down or pulled it out a little bit, like I just did. So, and that covers all of that. Thank you.